Hello, and welcome to Picture of Health. The Polk County Health Department offers services that improve the health of all residents. The medical professionals that provide these services are crucial to our community, and they depend on the hard work of those in marketing and communications roles to spread awareness about health and wellness throughout the county. On this month's episode, we have special guest Scott Schaublum in the studio to talk about his experience as a communicator in the health field. Now, Scott, welcome, and thank you for being with us today. Now, tell me about yourself and how you started your career in Polk County.
Hey, Linda, it's good to be here. Thanks for having me. I'm one of the few people who are lifelong residents of Polk County.
Really?
Yes, ma'am. Yeah, I was born and raised in Bartow, and for 3 generations back, my family has lived here. And so, graduating from Bartow High School, it was a neat thing for me to get to figure out a way that I could serve my community.
That's great, because then you know what's going on in Polk County, having that, you were born and raised here. So I am sure that helps a lot in the job that you're doing for the health department.
I think it does. There's situations that come up almost every day in which maybe it's an issue in North Lakeland or a particular concern down in Frostproof. These are places that I'm familiar with.
Right.
I've spent time in these locations, and so it means something to me to be able to assist those residents in trying to have a healthy lifestyle.
That's great. Now, can you tell us a little bit about the Florida Health Department in Polk County and how it benefits or how it helps the citizens or the community in Polk County?
Sure. There's a little bit of confusion about exactly what the Florida Department of Health in Polk County does.
Yes.
Many of our residents know us as the Polk County Health Department.
Right.
And so they think that we're a county entity. But actually, we're a state entity. We're part of an integrated health system that collaborates both on a local level with community partners and then coordinated efforts all the way up through our state. And so the common perception of the health department is that we're the people who beat the drum for vaccines, and we help people with issues maybe like sexually transmitted diseases.
Right.
And those are certainly things that we do. But really, we offer a wide variety of services. Anything that would be connected to protecting, promoting, or improving the health of Polk County residents. Those are things that we're heavily invested in.
Right. And basically, I think communicating to the residents as to what is needed to maintain a healthy lifestyle and to be in good health is part of your role. Is that correct? Or
absolutely.
Can you tell us a little bit more about your role in the health department?
Sure. Most people are familiar with a primary care model of health. If I'm sick or a member of my family is sick, we go to the doctor and we get the treatment that we need. Public health is similar, except that we are concerned with the health of a community. And so we are directly working day in and day out with the issues that affect that. So it might be trying to provide answers to questions like, how do I know that the drinking water that comes out of the tap is safe? How do we know that the septic system that's being installed is not going to contaminate our groundwater? Who is ensuring that young moms know how to properly breastfeed their children? Who is engaged in disease investigations from an epidemiology standpoint? Those are all services that the Department of Health is actively engaged in. And so my role as the communications manager is to really make sure that all of the information that is shared within the department, both internally and then externally with residents, is clear, that it's concise, that it's understandable, that it's coordinated, and presented in a way that makes sense and folks can understand.
That's correct. And this is my other question. Do you have a background in medicine or in healthcare at all?
No, actually,
No.
I don't.
Okay.
My experience and background is in nonprofit organizations
Okay.
and leadership and communication in that arena. And so I came to the field of public health almost as a novice. I like to tell people that, you know, I'm not a doctor, but I play one on TV pretty regularly. And so what that means for a person like me is that I have to have really great relationships with the leadership and the department. And we're very fortunate in Polk County to have really a wonderful team of people from our environmental health side of things to our Women, Infant, and Children program, all the way up to our director, Dr. Joy Jackson, who is just an excellent wealth of knowledge in terms of what it takes to keep folks safe.
You know, talking about the medical, there's such a thing as a medical jargon. So when you are preparing a press release or something to give out to the community, sometimes, you know, when patients talk to physicians, most of the time they don't understand exactly what they're saying. So how do you do that in terms of making sure that the public understands exactly what you're telling them, whether it has to do with communicable diseases or an infection, you know, that's happening here in Polk County? So how do you do that?
This is one of the ways in which I think having a background not connected to public health is actually a benefit. Really the threshold that I have with my staff is this needs to be written in such a way as I can understand it.
Right.
We engage practices that we refer to as plain language standards. When we're putting together information that we know is going to be consumed by the public, we want to do very simple things like make sure we write short declarative sentences. We intentionally try to choose words that have 2 or fewer syllables. We want to review everything that we read to make sure that we're not overly using acronyms. You know, the big joke is that, you know, technically I could tell you that I am the Region 4 DOH-PIO, and that doesn't tell you anything.
Said, what is that?
Right. So we have to continually stay on our toes to make sure that when we're reading things or writing things, that it's written in a way that a public can understand, because it really doesn't matter how valuable the information we're sharing is if it can't be understood.
Understood. That's correct. Because you can tell them one thing that they can't understand, then really your communication is not doing anything. Right. So that's great. Now, can you give us or can you tell us about what your typical day is at the health department?
You know, I've got a great job.
It looks like you really like your job.
Well, I do, and part of that is because, as I mentioned, I've really got a great team of people that I get to work with every day. And so for me, my day starts with what I call situational awareness. Now that's code for reading the newspaper. I need to know what's going on in our community. And so my day generally starts with about an hour of reading. I try to read 2 local media services and some national services, so I have an idea of what's going on. I have a briefing each morning with my administrative staff, and then generally speaking, my mornings are reserved for project work. So maybe we're putting together a video campaign, maybe it's a press release that we're working with, and then afternoons I try to keep scheduled for meeting with our various subject matter experts or community partners.
Okay. So you really have a busy day.
Almost always, and I have a phone that I have to carry with me at all times, and so I'm never really too far away.
That's right. And now with the cell phones and with everything else that we have, you know, I mean, it's like you can't get away,
it's
really.
tough.
Yeah. So what do you think is the biggest challenge that you have in the work that you do?
You know, I would say from a communication standpoint, it's continually trying to balance the proactive and reactive nature of our work. proactively, we want to be out front sharing with residents what they need to do to stay healthy and safe. Unfortunately, there's also times and situations where we're put in a reactive position where maybe an issue has come up, maybe there's a critical need that we need to get out to folks, a piece of information. And so it's kind of keeping these things in balance to make sure that we're putting things out there and we're sending the right message to the right person at the right time.
Can you give us an example of something that is reactive as opposed to proactive?
Sure. One of the neat features that happens behind the scenes with the Department of Health is we have an extensive surveillance network that is made up of community partners, all the way down to things like sentinel chickens that give us insight into what our mosquito population is doing. So a reactive thing might be if we receive word that one of our sentinels has tested positive for a particular mosquito-borne illness. Well, that's something that we want to share with people in that community so that they take the proper precautions to drain and cover, drain any standing water and cover themselves and make sure their windows are covered to reduce the chance that they're bitten by a mosquito. So it doesn't really matter kind of what may be on my to-do list for that day. If we get an alert from one of our various agencies, we have to put those things aside and we jump into action immediately.
Let's take a quick break and see what IFAS Extension's Whitney Fong has to teach us this month about nutrition.
Hi everyone, my name is Whitney Fung and I'm the Family Consumer Sciences Agent at UF IFAS Extension Service and Indigent Healthcare Division. Today we're here to talk about some healthy living tips. We're on tip number 2, enjoy your food but eat less. You might be looking at me, or maybe even the foods next to me, and wondering why I have all these junk foods and yummy foods next to me when I'm supposed to be the nutrition expert, right? Well, I'm here to tell you that I'm not going to take away your ice cream. I'm not going to take away your cookies or anything like that. We're here to talk about our foods, how we love them, and enjoy them, but eat less, right? So enjoy your food, but still take your time to eat while you're having meals and things like that. And we'll talk about a little bit of those things today. And so the first thing is that sometimes when we eat too fast, we tend to eat a little bit too much, right? Especially when we have big plates like this. And so when you have a really big plate or even bigger plate, we might end up eating portions that are larger than normal. So eating too fast, you'd want to get seconds. And so when you get seconds, then you double your food and we end up eating more calories than we need and we can gain weight that way. Other times we can lose attention, right? Or maybe when you're watching TV or eating a meal on the couch, when we eat that way, you're not paying attention to what you're eating, you're just constantly eating, and then we can eat too much food that way as well. So pay attention to when you're hungry and pay attention to when you're full. So listening to those cues will prevent overeating, because you know that when you're hungry, that means that you're going to need to consume more food for energy, or when you're full, that you don't need to eat anymore. A lot of times we eat because it's just right in our face, right? And so we don't want to do that. We want to be able to enjoy our foods. One thing that research recommends is that if we have family meal times, children tend to be less overweight or obese. So family meal times, even if you don't have children, is really recommended because you can enjoy each other's company if you want to, right? But you sit together at a family meal and you eat slowly, you talk a little bit, and you just enjoy the foods that you want to eat. And so enjoy your food, but eat less. So we've talked about this plate. This plate has the ribeye, which is my favorite cut, but I only eat it on special occasions. And so you have probably an 8-ounce steak, and then you have 3 large chicken drumsticks, not so large, but about three or so, and this actually isn't real food, so I'm touching it, so it's okay. And then you have some vegetables, which I hope you're getting, because you want to make half your plate fruits and vegetables, right? And so I want to refer back to My Plate, which is what we've talked about in the past. So My Plate helps you look at that balanced diet and what food groups you want every single day in your diet. And so that'll prevent you from eating too much. It's about a 9-inch plate. And so you want to follow that and look at all 5 food groups. So one thing that I've prepared for you today here is somewhat of a more healthy or balanced meal, if you will, depending on how you cook it. But this is about 3 ounces, a portion of meat or protein. Then we have about a half a cup or so of macaroni and cheese. Now cheese, we want to choose the low-fat dairy if possible. So you might have made it with low-fat milk and added some cheese as well. And then you have, look at this plate, it's packed with vegetables, right? So you want to choose more vegetables because they tend to be lower in calories as well. And then you have that salad. Now don't douse it with dressing because then that'll lose the purpose of eating healthy, right? So this is kind of that balanced plate. But if you compare these two, you have this plate right here, and then you have My Plate. Take a second and think about it and see what I'm missing. What food group am I missing from this plate right here? So take 1 second and think about it. This might be a big hint, right? So I have a banana, but you don't have to eat bananas all the time. I do like them since they're affordable and I can stick it in my purse, but a fruit. So don't forget, on this plate, we were missing the fruit. We had the dairy because I'm counting some of the milk there, but you do need 3 cups of dairy a day. But fruit, anything you want, change it up. Be creative in the kitchen, try different foods, and make sure you have all 5 food groups every single day. If you want more information about any nutrition tips, go on choosemyplate.gov or feel free to contact me at the Extension office. Thank you for your time. I'll see you next time.
For more information on this tip or any of the other 10 tips to a great plate, visit choosemyplate.gov.
Thank you for joining us on Picture of Health. This month, we have special guest Scott Schaublum in the studio, the communications manager for the Florida Department of Health in Polk County. Scott, can you tell us what you love the most about being the voice of the Florida Health Department in Polk County?
Maybe the best thing about my job is getting to work with the people that I work with. Mm-hmm. Everyone understands when they go into a public servant kind of role, right, that you could probably go out and do the same thing you're doing and make more money in private practice. But the folks that come and work, particularly in public health, mm-hmm, all of us have a bit of a do-gooder streak, right, in us. Yeah. And so generally what that means is they get up and they come to work each day because they want to. Mm-hmm. And they're really passionate about making Polk County a better place to live, work, and play.
And I think that's true for most professionals who work in the healthcare field, is they have to have that something, that makes them interested and passionate about making sure that everybody is healthy, that they're following, doctor's orders and so forth and so on. So I think you're right, in that point. Now, do you know of any upcoming health events that you think the people who will be watching this program should know about?
In January, really one of the things that we're excited about doing is each year for Celebrate Literacy Week, we work with our school health team to put Dr. Jackson, our director, in with a local elementary classroom in which she gets to read a couple stories to them and then share some tips about what they can do, even as youngsters to stay
right,
healthy and safe.
Right. And I think that's very important. They need to start at a very young age,
Absolutely.
Like even before they're born, the mother needs to make sure
right,
that she maintains a healthy lifestyle in order to give the baby a chance to be born healthy.
Exactly.
So what is the biggest public issue affecting Polk County today, in your estimation?
Well, I would agree with our state surgeon general, mm-hmm, Dr. John Armstrong, and he has said that unhealthy weight is his #1 priority. Mm-hmm. And in Polk County, we see the same thing. So we're actively working to do what we can to see our obesity rate begin to go down. And so we've begun and worked with partnerships like Building a Healthier Polk.
With Polk Vision?
Yes, as a collaboration with Polk Vision, to see what we can do to pull together all the different community partners who could help us address that.
Yeah. And Dr. Jackson, when she was on the program, really talked a whole lot about obesity and the importance of making sure that you control your weight, because it affects a lot of people. It has something to do, obesity has something to do with the major disease entities, that we have.
Absolutely.
Cardiac, and
it's something we can do something about.
Right.
So if we make just a few simple changes in our habits, eating the right foods, reducing the amount of recreational screen time that we have, cutting out the sugary sweetened beverages. I mean, just really simple changes can really make a significant impact.
Right. And physical education, for the kids, like in the school system, I think is very important also. Now, have you learned anything new or surprising since you started working in terms of health?
Sure.
Since you started working with the health department?
Yeah, absolutely. I really feel like each day is a new learning opportunity, and so not having a background in public health, I feel like I know way more than anyone should about septic tanks or emerging infectious diseases. Of course, our previous director, Dr. Yuli Cho, is an infectious disease specialist, and so there were a variety of times where I felt like I was in a lecture hall as he would sit, and I'd hear him explain to community groups about the things that were out there. And so I think anytime you approach your job as something less than a learning opportunity, you're handicapping yourself somewhat, because I feel like each day I've got something new to learn.
Yeah. And I think that should be good for everybody. Every day is a new day, and make sure that you learn something new each day. So what advice would you give to people who haven't gone through medical or healthcare training but wants to work in the healthcare field?
And maybe it applies just
like
even
you.
broader to this, right? I think maybe the greatest skill set that I encourage my staff to have, and really than anyone else coming in, if you don't have a medical background, is learn to be a good listener.
Right.
If my mother used to tell me you have 2 ears and 1 mouth, so listen twice as much as you speak, which is hard for me because I like to speak. But I think if we can
communicators are usually like that.
Guilty as charged. So if we can learn to really listen, it helps significantly when you're meeting with your subject matter experts to hear what they're saying, and then how do I figure out to share this in a way that everyone could understand.
Now, Scott, if somebody comes to you and says, I really don't feel sick, I don't feel anything is wrong with me, why do I need to go see a doctor? What do you tell them?
Well, I would say that prevention, what's the old saying? An ounce of prevention is worth a pound of cure, right? Yes. So, what I would encourage folks to do is if they're not, feeling particularly sick, if they're current on their vaccination rates, then their routine physical would be sufficient. It's really when people do begin to notice that there's a change. That's something that they're going to want to connect with their primary care provider and seek attention as it's appropriate.
What do you think are some of the things that has, since you've joined the health department as its #1 communicator, what do you think, have you seen any change in terms of the health status of Polk County? Like, let's say, for example, obesity. Have you seen anything there since working with Polk Vision and other organizations about making a healthier Polk?
Well, I don't have the data in front of me, but I can tell you that in large part due to the efforts of organizations like Building a Healthier Polk and Polk Vision, we are making strides against our obesity rate. It's something that community partners from our school board, local businesses, area colleges, groups of primary care providers and pediatricians have come together and put a significant amount of effort into. And so I think the process is slow, but we're moving in the right direction.
Right, yeah. And I think that's true also because building a healthier Polk really involved a whole lot of people and a whole lot of organizations. So one way or the other, you know, I mean, change usually doesn't happen overnight. But I think it's the education that's provided to the general public that is very important, especially in our school system. Now, again, as the chief communicator of the Department of Health, what is one message that you can give to our viewers that you think will be very important in terms of them being more aware of living healthy, maintaining a healthy lifestyle?
Really, I think that the message that we're sharing as a part of our efforts to reduce the obesity rate is the simplest message for folks to understand, which is this 5-2-1-0 philosophy. So when we say those things, what we're talking about is 5. Try to incorporate 5 servings of fruit and vegetables into your diet each day.
Right.
2, limit your recreational screen time to 2 hours or less. Now that's not taking into account what some of us who have to work on a computer, that doesn't count. What we mean is when you go home, maybe not flip on the TV right away or fall into an iPad. And if you do, limit that to 2 hours. 1 hour of physical activity each day. Now, that doesn't mean you have to join a gym.
Right, yes.
Take a walk after dinner. Get your heart rate up. And 0 sugary sweetened beverages. So moving in the direction of ordering water with your meal as opposed to a soda.
Right. Let's take a quick break. Stay tuned. You're watching Picture of Health. Scott, thank you so much for joining us in Picture of Health. I am sure that people will have found something in the episode today that they can use in their daily life to make sure that they maintain health. Thank you. That's all the time that we have for today. You can catch this episode of Picture of Health on Mondays, Wednesdays, and Fridays at 10 a.m. or 4 p.m. on PGTV, or you catch all of our previous episodes on our YouTube page. I'm your host, Linda Pilkington. Thank you for joining me on Picture of Health.